to deliver welcome address and introduction about our chief guest. Thank you, sir. Sir, over to you, sir.
Thank you, Prakash. So, good morning, one and all. Also, I welcome our chief guest, Dr. T. Ramesh, Associate Professor, Department of Mechanical Engineering, National Institute of Technology, Tiruchirappalli, for giving a lecture on topic of role of composite material in biomedical applications. And I welcome all our UG students for attending this webinar. And I also welcome our faculty members who joined this webinar. So now I just introduce a formal introduction about our chief guest. Dr. T. Ramesh is working as an associate professor in Department of Mechanical Engineering, National Institute of Technology, Tiruchirappalli. He had a 24 years teaching experience from the year 1997 from various institutions, and he joined National Institute of Technology, Tiruchirappalli, the year 2006, and from 2006 he is working in NIT, Trichy. His publication, I think he published more than 72 publications in various journals. His citation, there is citation, his work is cited by many people. His citation in Google is around 2000, and his citation in Scopus Index Journal is around 1400. And he handled most of the subjects related to design subjects like engineering, mechanics, sensor materials, design of machine elements, design of transmission system, kinematics of machines, dynamics of machines, and particularly finite element analysis, MEMS, and vibration, and so on. He handled most of the subjects in design. And under his supervision, I think 4 students completed his PhD in the area of workability studies on aluminum silicon carbide powder metallurgy of composite material, design and analysis of micro gripper for MEMS application, and micro joining of nickel titanium alloys, and experimental investigation of optimization process parameters for conventionally sintered zirconia reinforced alumina composites using a RSM. And now I think 4 full-time scholars are working under him, and 5 part-time scholars are also working. And he actively involved many projects. He completed one project around 13 lakhs supported by Department of Science and Technology, the year 2008 to 2011. The title of project is experimental investigation and finite element simulation of workability and aluminum titanium carbide metal matrix composites during cold upsetting. And he involved told some consultancy projects supported by Bharat Heavy Electrical Limited, that is a BEL, Tiruchirappalli, and NLC Neyveli for the cost of nearly 1 crore. And his contribution to Thiagarajar College of Engineering is he is a doctoral committee member for many supervisors of our college, and he is an Indian examiner of many supervisors of our college. He was acting as external examiner for a UG project as well as a PG project, and he involved in board of studies meeting also for BE mechanical engineering. This is the introduction about our chief guest. So now I just handed over the session to Ramesh sir to deliver the topic on role of composite material in biomedical applications. Ramesh sir?
Yeah. Thank you, Dr. Balasubramanian, for detailed introduction about
Thank you, sir. Thank you, sir. Thank you.
It's my pleasure to associate once again with the
because our students are more, there's a first year students and second year students are available, so we must give a detailed.
Yes, sir. Yes, sir. Yes, sir.
Thank you. One second. Thank you, sir.
Yeah. Thank you very much for the opportunity given once again to meet the young minds of Thiagarajar College of Engineering. As Sir rightly pointed out, I have been involved with many activities in Thiagarajar Engineering College for more than 10 years, I hope. Today, we'll have a discussion on the role of composites as a biomaterial in biomedical engineering. Maybe the topic is slightly advanced, but as a beginner, this is the right time to seed you with the novel technologies and advanced technologies, so that you'll be selecting or opting a particular research interest in your research domain. Second year, especially as second years, it's a right time to go for any internship in this particular area, where you have a large scope to be involved and develop new systems and the materials for the benefit of the society. Just by seeing the title, don't be afraid that why he's talking about biomedical engineering, because we are very poor in biology, or we are not quite interested in biology subject, am I right? But it is, the biomedical engineering is not the subject of pure biology, but it is a integration of many engineering disciplines, starting from materials, mechanical design, manufacturing. All those things are involved, apart from the suggestions from the from the doctors or recommendations from the doctor. We are in the forum of helping the doctors to design a device which is being used in a biomedical environment. So I'll just start with what is biomedical engineering first, and so the role of mechanical engineers are highly required. You know that you have already completed the subject called engineering mechanics. It is more of, or even strength of materials. It is more of a stress strain of a material. Even the human is treated as a biomaterial. There you have understand that the concept what you learned in engineering mechanics and strength of materials are highly involved, especially in the design of implants for the humans. So biomedical engineering or medical engineering is the application of engineering principles and design concepts to medicine and biology for healthcare purposes. So this is a small information about the biomedical engineering. It seeks, or this particular field seeks, to close the gap between engineering and medicine. So earlier, engineers are not permitted to involve in any of the medical activities. And now the trend has been changed because interdisciplinary research are highly required for today's scenario. So it combines, or it's a combination of design and problem-solving skills of engineering with the medical biological sciences to advance healthcare treatment, including diagnosis, monitoring, as well as the therapy. I think few words may be new to the budding engineers, but if you spend 1 or 2 hours to understand what is what, then it is very good. You can progress your field of research in this particular domain also. So an evolution is common as a new field transition from being an interdisciplinary specialization among already established fields to being considered a field in itself. So much of the work in biomedical engineering consists of research and development spanning a broad array of subfields. What are the subfields we have? See, the prominent biomedical engineering applications include the development of biocompatible prostheses, various diagnostic and therapeutic medical devices ranging from clinical equipment to micro implants, common imaging equipment such as MRIs, EKG or ECGs, regenerative tissue growth, pharmaceutical drugs, and therapeutic biologicals. So all these things are required the help of mechanical engineers or your knowledge, what the knowledge you gained in the mechanical engineering domain will really help the medical field in devising a new designs of the implants, understand the functionality of the implants, what we introduce into the human body by means of various studies. So I hope everyone agree with me, like the role of mechanical engineers are very high in the pandemic situation, where they have developed large amount of face masks for helping the people who involved in the pandemic situation, so that it will be protected them from affecting the viruses. Am I right? So face mask is completely designed and developed by mechanical engineers, and it is manufactured by means of advanced manufacturing technology called additive manufacturing. So all these things are really help in a pandemic situation to protect most of the frontline, whatever we call this, the workers from affecting them from the viruses. So it has been, as I was mentioned, that there are number of subfields available in biomedical engineering. It is not a single area where you can spend, or only the doctors are permitted to work with, but it is categorized into different groups. Like, so it may be for bioinformatics, which is an interdisciplinary field that develop methods and software tools for understanding biological data. See how the biological tissues are behaved, or how the organs of the human behaves. So that will be completely captured by means of in the form of data, and those data will be analyzed and simulated with the help of software tools developed by engineers. So as an interdisciplinary field of science, bioinformatics combines computer science, statistics, mathematics, and engineering to analyze and interpret the biological data. So you just understand that it is not only the responsibility of the doctors or the person who had knowledge in the biological area, but also various people, so starting from computer science people, statistics, even mathematics people are really involved in formulating the mathematical equations for further analysis from a physical system. And many engineering domains are required. Even electrical engineers are required, mechanical engineers are required, production engineers are required, and the material engineers are required. So those multi-domain people are really involved in developing a particular system. And biomechanics is a study of structure and function of the mechanical aspects of biological systems at any level, from whole organisms to organs, cells to cell organelles, using the methods of mechanics. So whatever the mechanics we learn from engineering mechanics, it is well suited with, or it is well correlated with the mechanics of the biological system. So a biomaterial is any matter, surface, or construct that interacts with the living systems. So as a science, biomaterials is nearly 50 years old. It is not new. But in India, still we are in the developing stage, or we have a large gap between engineering and involvement of engineering in the biological field. So that should be avoided, or that should be minimized by taking number of researchers in this particular domain. People like you should come forward to work in this particular field. So the study of biomaterials is called biomaterial science or biomaterials engineering. And the biomaterial science encompasses elements of medicine, biology, chemistry, tissue engineering, and material science. So by keeping all this in the mind, I think the Anna University has reframed the syllabus structure by introducing biology as one of the subjects in the entry-level courses, as an entry-level courses. I hope it has been implemented from 2020 onwards. I hope so. But we have a sort of suggestion in our own Senate for introducing such kind of biological subjects. But now it is been offered as an elective course for mechanical or materials or production engineers, etc. Then another important area where the role of mechanical engineers are highly required is genetic engineering, which recombinant DNA technology, or genetic modification and manipulation, and the gene splicing are terms that apply to the direct manipulation of an organism genes. So unlike traditional breeding, an indirect method of genetic manipulation, genetic engineering utilizes modern tools such as molecular cloning and transformation to directly alter the structure and characteristics of target genes. So this has already been existing in the agriculture field, where we have manipulated or genetically modified seeds are available now, right? With the high quality products. It can yield high quality products because all those things are genetically manipulated. So the neural engineering, also known as neuroengineering, is a discipline that uses engineering techniques to understand, repair, replace, or enhance the neural systems. And the neural engineers are uniquely qualified to solve design problems at the interface of living neural tissue and non-living constructs. So the idea of artificial neural networks are highly required in this particular domain. So where you can understand the problem, repair and replace the damaged neurons in our system, living system. Then another important area is tissue engineering, which is a major segment of biotechnology. This overlaps significantly with biomedical engineering. See, one of the goals of tissue engineering is to create artificial organs for patients that need organ transplants. So now you might have heard news about implantation or organ transplantations from the artificial organs, by developing artificial organs. So biomedical engineers are currently researching methods of creating such organs, and researchers have grown solid jawbones and trackers from human stem cells towards this end. So several artificial urinary bladders have been already grown in laboratories and transplanted successfully into human patients. Then bioartificial organs, which use both synthetic and biological component, are also focus area in research, such as with the hepatic assist devices that use liver cells within an artificial bioreactor construct. So now the idea is how to manufacture such kind of a complex system, and what are the suitable materials to be used for printing such kind of human organs. So now the knowledge of material engineers are highly required, the mechanical engineers are highly required, and the manufacturing engineers are highly required to combinedly work together in order to arrive a new system for developing such kind of organs from the suitable materials. So these are all a few examples already printed by means of additive manufacturing. I think you might have heard this word first time, or in your introduction to mechanical engineering or manufacturing concepts might have discussed in your syllabus with recent advancements like new manufacturing technology called additive manufacturing. So these are all manufactured through additive manufacturing. The reason, because every cross section, it has its own geometry, as well as the material property. So these three are 3D bioprinted artificial human organs, and this is one such kind of organ, which is the video captured during the bioprinting of artificial human organs. So in this technology, what it will do is it will manufacture the device or the organs layer by layer. So every layer, after finishing a layer, it will grow another layer over it. So there are printers available, very low-cost printers are available nowadays. Even for 10,000 to 15,000, you can get a You can get your own printer nowadays, by which you can really see the design what you there in your mind. So that will be converted in the form of 3D objects, and then even functional objects can also be printed. So a medical device is intended for use in various purposes, like it has to diagnose of disease or other conditions, and it will be employed in the curing, mitigation, treatment, or prevention of diseases. So there are two different functionalities a medical device can do. So these are all the examples of medical devices already developed by many engineers and implanted into the human for real studies. So this is a pacemaker. As you know that it is already employed in many persons in order to successfully or enhance the working of a human heart, right? So this will send electrical pulses through this through this wire or stent. Normally we call it a stent. That will activate whenever the heart enabled to supply the enough blood, right? So this is the function of this particular pacemaker. So it will send electrical signal or electrical pulses so that it will activate the human heart. Our infusion pumps, and this is one such. Normally, you'll be using it, or so many persons are using it for correcting their teeth by means of bioscrews. So the gap will be filled by means of bioscrews, and this is a ceramic material, composite material, used to connect or bridge a gap between the nearest tooth. And so these are all the other implants already developed by many materials. For example, like titanium or polymer-based composite material implanted with or reinforced with metal particles or fiber or even biofibers, etc. So this is a portion of a knee or knee cap. Due to some disease, the process has been completely destroyed. So it has been replaced by means of a titanium implant over here. So it do whatever the function the knee joints does. So this is the replacement of the chest bone. Due to some accident, a person has lost their bones, so it has been completely replaced by means of metal implants. And facial processes are highly familiar nowadays. You can correct your face informations, whatever the lost you had in your face or the head, whatever you have, that is completely replaced by means of appropriate materials. And artificial limbs are already existing, where number of persons are living with artificial limbs nowadays. Even the players are volleyball players or football players are using this particular limbs for continuing their attitude after losing their leg. So as we know that the mechanical engineering covers a broad range of disciplines, including materials. We gained knowledge on mechanics, systems and control, and we had some idea about thermodynamics, fluid mechanics, design and manufacturing. If you are not covered so far, I think these subjects will be covered in the near future. All of which constitute a solid foundation for bioengineering. See, the thermodynamics, so how the thermodynamics and fluid mechanics are the knowledge gained in thermodynamics and fluid mechanics helps me in this particular domain. So after all, our body is 7% of fluids, am I right? Fluids. Without fluid, nothing could be done. So whatever the mechanics you learn through these engineering subjects, that will help in, or that will be the foundation for working in bioengineering field. Then the research includes bioimaging and the bioinformatics, bioinstrumentation and design, biomaterials and tissue engineering, and finally biomechanics. So the research scopes are not limited, but I have given only the top researching areas where the mechanical engineers are highly involved in developing bioimaging components and the bioinformatics, bioinstrumentation and design, biomaterials and tissue engineering, and then biomechanics. Then what is biomaterials? I have quoted only biomaterials here because our focus is on biomaterials. So we need to develop a new material which is biocompatible in nature. So you cannot use a certain material into our body, living tissues, because it will produce large amount of harmness to the living system. So it has to be completely analyzed before putting inside the human body. We have a large amount of tests to be conducted before introducing any materials in the biological field. Then a biological or synthetic substance which can be introduced into body tissue as part of an implant or medical device, or used to replace an organ or bodily function, etc. And a biomaterial is any substance that has been engineered to interact with biological systems for a medical purpose. Either a therapeutic, that is, the material may be used for a treatment or augment or repairing or replacing a tissue function of the body, or a diagnostic one. So whether you treat it or understand it, whether you are infected with that particular disease or not. So as a science, biomaterial is about 50 years old, as I was mentioned earlier already. The study of biomaterial is called biomaterial science or biomaterials engineering. And the biomaterial science encompasses the medicine, biology, chemistry, tissue engineering, and material science. And a biomaterial is a non-viable material used in medical device intended to interact with biological systems, and it has to provide, or it has to satisfy with the biocompatibility property. Then what is a biocompatibility property? So this is the property or the ability of a material to perform with an appropriate host response in a specific application. So suppose I replace a knee joint by means of titanium. So titanium should not give any harmness to the material which is surrounded it. Like a tissue may be covered over there, there are skins and there are neurons. So all those things are to be considered before introducing any material. And this is the term called biocompatibility. Whether the material is biocompatible in nature, there is no chemical reaction is permitted inside our body. So what is the host responses? So say for an example, the host responses include resistance to blood clotting and the resistance to bacterial colonization and normal uncomplicated healing. It should not produce all these harmful effects in the body. Then what is specific applications? This include a hemodialysis membrane, a urinary catheter, or a hip joint replacement prosthesis. So note that the hemodialysis membrane might be in contact with the patient's blood for 5 hours, so that the catheter may be inserted for a week, and the hip joint may be in place for the life of the patient. So all these things are to be considered before introducing any material for biomedical applications. So this is a illustration of various implants and devices that are used to replace or enhance the function of diseased or missing tissues and organs. You just see how many areas we have a stethoscope. So starting from breast implant, so vascular implant, wound repair closures, so IV catheters, validating stent, orthopedic implant, fixation device. So there are many locations where the mechanical engineers are really involved. so that they can develop a suitable materials and methodologies to develop a new device with the biocompatible nature, so that the doctors will be very happy to associate with the engineering field. So this is one such example. Say this is a titanium 3D printed implants that are part of a personalized total solution for orthodontic surgery, also known as corrective jaw surgery, as well as for facial reconstruction. See here, see how many implants they used. Say this, what do you call this? Orthopedic bones are fractured when a person met with an accident. So this has been completely corrected by means of introducing number of implants. So this is an implant one which connects the upper jaw portion with this portion, and then the lower jaw is completely corrected by means of or repaired by means of introducing so number of implants. So these implants are perfectly introduced into the body by means of are perfectly placing in the body by means of bio screws. Those screws are drilled and put it inside the bones, right? So now the question is whether the material used for connecting the implants with the repaired or the broken bones. Yes, of course, that also should have biocompatible nature. See here, there are other kind of implants. So now the question may arise, like, do you have a common implant which is readily available in the market? The answer is no, because every human has their own body structure, their own bone topology, their own bone mineral density. So now the thing is, say how to develop such kind of implants. It is not, as I was mentioned, it is not generic. So every patient will be scanned under MRI or CT, and then those images will be converted in the form of three-dimensional objects with the help of biomedical imaging softwares, and we'll be performing finite element analysis for understanding the behavior of those implants when you are keeping the component inside. So all those things are done by means of mechanical engineers, and then the implants will be manufactured by means of adapting suitable manufacturing methodology by production engineers. So this is one such example, see correction of what you call this facial reconstruction, and this is the teeth implant, and there are many other examples I want to put here, right? So this is one such biomedical device which is not used for repairing and reconstruction, but for treatment. So now this is a device called a micro robo, which is controlled from outside. The movement of the micro robos are controlled from outside through electromagnetic induction, electromagnetic energy, and then it will be delivered to the exact, the drugs will be delivered to the appropriate location where the tissues are damaged or where it finds the viruses, whatever you call it. So the role of mechanical engineers are highly solicited in the case of biomedical engineering nowadays. So especially biomaterials are used in various applications, starting from joint replacements, bone plates, intraocular lenses for eye surgery, bone cement, artificial ligaments and tendons, dental implants for tooth fixation, blood vessel prosthesis, heart valves, skin repair devices, that is artificial tissues, development of artificial tissues, cochlear replacements, contact lenses, breast implants, drug delivery mechanisms, sustainable materials, vascular grafts, stents, nerve conduits, and surgical sutures, clips, and staples for wound closure. I think nowadays, small surgery are not being After the surgery, the doctors use small clips or staples to close your tissues. Am I right? I think those who have already uh, under surgery or seeing some person who related to surgical operations, you might have seen that they were not used any what do you call it, a nose-like system as we used in the olden days, but they use staples. The staples are biomaterial staples, so which will be put it in your skin so that it will completely close the wound. Then biomaterials are also used in pins and screws for fracture stabilization, surgical meshes, etc. So these are all a few examples where you can use biomaterial as a or the mechanisms involved in developing materials, biomaterials. So this is for joint replacements. You can see here that there are femoral stems. It's a ceramic femoral head and the ceramic insert, and this is the acetabular cup. So this complete section is replaced by means of either metal or composite materials. See here, it is a polyurethane insert and it's a metal femoral head. So made from a single material like titanium or stainless steel or ceramic or composites, whatever you have. So this is one such implant used to connect the broken bones. See here, this bone is completely connected by means of intramedullary rod. And these are the plates, and this is a rod which is piercing throughout your bone, correct? See here, it starts from here and ends over here. It is like a screw which is drilled and inserted so that it connects the broken bone. And there are pins used to connect damaged or repaired damaged bones, a femoral bone. And the contact lenses already in existing. So the contact lenses are already developed by through biomaterial. And then it may be used for bone or bone cement, prosthetic applications, and then vertebra can be replaced by means of suitable material, or the healing of this particular vertebra is also can be done with the help of bone cement, just by injecting appropriate cement material inside our body, so that the broken area or the fractured locations will be repaired by means of introducing appropriate bone cement. So this is the left knee with the implant, and the cross section is given over here. So the ultimate goal of using biomaterials is to improve human health by restoring the function of natural living tissues and organs. That is very important. It should not affect the functionality of natural living tissues and organs, and it should restore the function of the natural living tissues and organs in the body. And it is essential to understand relationship among the properties, functions, and structures of biological materials. So there are three aspects of study on the subject of biomaterials can be envisioned. One is biological materials, and other one is implant materials, and third one is interaction between the two in the body. See, the success of biomaterials or bioimplant is highly dependent on three major factors. See how much biocompatible the developed material has, and what about its health conditions, and the competency of the surgeon who implants and monitors its progress. So it is easy to understand the requirements for an implant by examining the characteristics that a bone plate must satisfy for stabilizing a fractured femur after an accident. So now the biocompatibility property of the material can be of two different categories, like It may directly interact with the cells or muscles or ligaments or fat or bones and organs. So the material what you suggest or what you develop should have a suitable interaction with all these human organs like the cells or muscles, organs, etc. Or it may be of biomaterials which should have the necessary chemical, mechanical, pharmacological, and surface properties. So, for example, mechanical in the sense, the biomaterial should have appropriate corrosion resistance, and it should have a biodegradation property, and it should allow the protein deposition, encapsulation, and then calcification or toxic leaching, embrittlement, cell lysis, systemic reaction. So all these things are required in the case of mechanical material. See how the one such clarification I want to point it here, like how the calcification is done with the help of mechanical. So the material what you suggest should have or should allow the growth of calcium in the bone, right? Or it should permeate the device what you suggest through biomaterials should permeate the tissues to grow inside, right? It should not be toxic. So the idea is, while you choosing biomaterials, one should keep all this in their mind. So they have to design the material in such a way that it should have corrosion resistance, and then degradation is permitted, because the material is a third-party material when it is kept inside our body, or a foreign material which is kept inside our body. It should be degraded after a long time, after a particular period of time. Say, for example, so this bioscrew with the bioplates, after the healing is successfully done, or the bone has enough strength, then it should be degraded of its own, right? So what will happen is, after a long time, you don't find any symptoms of a foreign material available inside our body, So that is very important. Or certain materials, after a period of time, they go for another surgery and will remove the implants. Now, the scenario is not like that. We have very good materials which has a good degradation property. So that will be degraded on its own inside our body. Then acceptance of the plate to the tissue surface, that is biocompatibility. And pharmacological acceptability, that is non-toxic, non-allergenic, non-immunogenic, non-carcinogenic, etc. And chemically inert and stable, no time-dependent degradation, and adequate mechanical strength, adequate fatigue life, sound engineering design, proper weight and density, relatively inexpensive, reproducible, and easy to fabricate and process for large-scale production. So all these things are highly required in the case of developing a new material. It should have adequate and mechanical strength. Suppose your bone has a tensile strength of, say, 120 to 140 MPa, then your bio implants should have an equivalent or slightly higher mechanical strength, so that appropriate transformation of load from one bone to other bone should be taken care by the bio implants. Similarly, adequate fatigue life is required. So before going for introducing any bio implants, it should be thoroughly tested under fatigue or the life of the material under fatigue should be predicted. Then various class of materials used in the body is summarized here. So starting from polymers, we have an example of nylon, silicone, rubber, polyester, polytetrafluoroethylene. Then what about the advantages and limitations? The examples are quoted in this particular slide. The advantage of using polymers is resilient, easy to fabricate, but it has a limitation of poor strength, but deforms with the time, may degrade. And then the examples already developed devices are sutures, blood vessels, other soft tissues, and then hip socket, ear and nose. All those things are manufactured already by means of are from polymers. And metals are used already, say like for example, so titanium and its alloy are stainless steels, etc. Now the advantages of using such kind of metals are strong, tough and ductile, but it may corrode or the density is very high, difficult to make, because difficult to manufacture. Now the examples are, so already joint replacements are made from metals, dental root implants are manufactured, a pacer and the suture wires, bone plates and screws are already existing from material like metals. And the ceramic like alumina, zirconia, calcium phosphates, carbon, etc. All those things are already used. When you see the advantages of such kind of ceramics, it's very biocompatible. Compatibility of the ceramics is very, very good. But it is brittle in nature, not resilient, weak in tension. So those are the limitations of such kind of material. Examples are already dental has used exhaustively the ceramic materials, and orthopedic implants are already used this ceramic as a material for replacing the damaged or broken orthopedic implants. Then composites, in the case of carbon-carbon, wire or fiber, reinforced gold cement. When you see the advantages, the composites are very strong, and it is possible to prepare the composites as per the requirement of the human, like it is a tailor-made. But the limitation is difficult to make, and examples are bone cement, dental resin, etc. So as I was mentioned, that the biocompatibility is very important parameter in the case of biomaterials. So what is biocompatibility? It's the acceptance of an artificial implant by the surrounding tissues and by the body as a whole. So this is a property which accepts the artificial material when it is kept inside by the surrounded materials like tissues and by the body as whole. The biomaterial must not be degraded by the body environment, and its presence must not harm tissues, organs, or systems. If the biomaterial is designed to be degraded, then the products of degradation should not harm the tissues and organs. So one such limitations I want to quote here, when you use metals as a joint replacement, and you just think about the tensile strength of titanium or the tensile strength of stainless steel. So when you compare, these two are the bone and the tensile strength of the bone and the metals, you have a large deviation. The bone will have roughly 100 MPa, but the metals have 450 to 600, even 700 MPa. So because of mismatched material properties, one such drawback I want to quote here is stress shielding. So people will feel very pain when you have a different kind of materials are used. So now it is very well understood that instead of metals, if you use composite as a material, as it is a tailor-made property can be achieved, then the very important limitation like stress shielding is completely avoided instead of using metals if you use composites. Then other important property, the requirement are illustrated here. I think I'll just skip this. So these are all various implants which developed by many researchers around the globe. So starting from musculoskeletal system, cardiovascular system, respiratory system, digestive system, genitourinary system, nervous system, and special sensors, other soft tissues, cosmetic implants, etc. And these are transient implants, like the external dressings and the partial implants. It's a temporary artificial skin or immersion fluids. So this is the notable developments relating to implants by many researchers. You can be wondered, like the work has been started in the year late 18th or 19th century, like 1860 and 1870. Lister has developed aseptic surgical techniques or proposed aseptic surgical implants, and various metal devices to fix fractures, wires and pins from iron, gold, and the other metals were already used in the 18th and 19th century. So these are the list of developments relating to the implants. So now you can find that, say, how these different materials are used in various situations. I think the polymers and the composites are playing a major role, are taking a lead in 2027. It is a projection by WHO, World Health Organization. It's a predicted results. So biomaterial science addresses both therapeutics and diagnostics. So this is the path from the basic science of biomaterials to a medical device to clinical applications. So research on biomaterials is highly required with the chemistry, physics, material science, and biology knowledge. And then the knowledge of engineering is required to develop a medical device. And the preclinical and the clinical testings are to be conducted. And then it is regulatory approval is required from the appropriate authority. And then commercialization and the clinical application is the end of the path, right? It starts from research and end with a commercial product. So now the idea is not developing so many clinical applications. The products are still, it is imported from outside the country. I think I'll just skip this. Yeah. So let us see the composite materials, the role of composite materials in biomedical applications. So it is understood that metal has a single, what you call it, a monomer structure, but a composite will have different structures. So see, it contains two or more distinct constituent materials or phases on a microscopic or macroscopic size scale. So here, the term composite is usually reserved for those materials in which the distinct phases are separated on a scale larger than the atomic, and in which properties such as elastic modulus are significantly altered in comparison with those of a homogeneous material. So a metal has a homogeneous in nature, but the composite will not have. Accordingly, the fiberglass and other reinforced plastics as well as the bone are viewed as composite materials, but alloys such as brass or metal with the carbide particles or not. So natural composites include bone, wood, dentin, cartilage, and the skin. And natural foams include lung, cancellous bone, and wood. Natural composites often exhibit hierarchical structures in which particulate, porous, and fibrous structural features are seen, on different lengths here. I think by showing a picture, I think it is a very understood. It is understandable that how the bone is. So it is not a single material. It's a collection of large amount of material, very similar to a composite. As it is claimed that bone is a perfect example of composite material designed by the nature. Here, minerals are embedded as reinforcing elements, while the collagen serves as matrix. So any composite material will have two different informations. One is matrix and the other one is a reinforcement. So matrix is a soft material which hold the reinforcement in it, and the matrix serves to distribute the fibers and also to transmit the load to the fibers. See here, so this is a cross-section view of a bone, a human bone. You can find that there are fibers, and this is a compact bone, and there are blood vessels passing through it, am I right? And so this is a matrix material which hold the entire information inside, and even the matrix will have different structure, like it could be of a spongy in structure or hard in structure. All those things are completely packed in the matrix material. So here are the examples like how the spongy bones are. When you cut the bone, a human bone, you don't see a solid inside. Inside you will have a spongy bone. So these spongy bones are a porous structure, will permit the tissues to grow inside. So this is a cartilage which connects the cap with the bone, hip bone. And there are other parts like periosteum, endosteum, bone marrow, and the nutrient foreman, etc. I think when you are interested, you just go through all these things later on. Now let us have a broad idea about the applications of synthetic materials and modified natural materials in medicine. So these are all the various applications developed through biomaterials, like joint replacements, they use titanium, stainless steel, or polyurethane. I think the number per year is given worldwide. Metals, PLA, calcium phosphates. So there are many materials already identified. I think there are large amount of research required in these particular composition materials. Sir, I think with this I conclude the session. Any doubts? I'm happy to interact with all of you.
Thank you, Ramesh sir. I think you have given detailed information about biomaterials and biomedical engineering, and then you discussed a lot of applications of biomaterials and how it's made, particularly in 3D printing, and then you have a clear idea about requirements of biomaterial in a mechanical point of view, as well as you listed some limitations and advantages of all the biomaterials. Now, some students have posted some questions. Just to read out the question. So Nagappan, there are various chemotherapy surgery techniques are available for cancer treatment, but efficiency is nearly 10%. Is there any works undergone to develop cancer treatment machines at any stages? Is it possible to develop using composite materials?
Thank you, Nagappan, for your wonderful question. Why do you put a question like, is it possible?
Okay, sir.
It is possible. See, all of you, you are the keen person to develop such kind of machine. See, now the cancer treatment are done with the help of laser-assisted machines. I think, as I was claimed, that I accept that the efficiency is less than 10%. The people are working in this particular chemotherapy, in order to improve their. But now the thing is, instead of going for a chemotherapy, people are thinking about a novel drug delivery system. So instead of damaging the tissues which is surrounded by the cancer tissue, so directly they send a drug to that particular location. They use a signal from outside, so they bombard it and they deliver the what do you call this medicine. So now the familiar or the famous technology used this drug delivery system in the form of micro robots. Now it is possible. People are not thinking about chemotherapy, but they use for some other modality to sort out the problem. Yeah.
Okay, sir. Thank you. Sir, can you suggest some areas in which mechanical engineers may concentrate on biomaterials? So that is a booming area. Or,
Yeah. So especially in orthopedic, we required a large amount of scope. Like bone replacement, bone replacement, so designing of implants. And dental side, we have a large amount of scopes. And even, I think, if time permits, I'll show you a small example available in Mimic software. Yeah. Sir, can I take 5 more minutes?
Okay, sir, no problem.
Yeah.
I'll just show the slides.
Are you able to see my screen?
Yes, sir, it's visible.
Yeah, it's a software called
software.
Mimic.
Just
yeah. I think I'll load a small. Yeah.
Oh.
So this is a CT scanned image.
Oh. Bone. There is a backbone.
Backbone. It's a 3D model. Now, you see the complexity of this model. So no software so far developed to directly generate 3D models of what do you call this? Home.
We can generate 3D models using SolidWorks and other things. You can generate some CNC code, but it took more days to develop this kind of model.
Yeah.
But
the thing is, it is completely developed from Mimic software.
Oh.
Now the CT scanned image data, it is like a stereolithography file. Every layer will have its own information. So one more advantage is you can directly send it for fabrication using additive manufacturing techniques. So this is the backbone captured from a patient through CT scan.
So what is the name of the software, sir?
Mimic, sir. M-I-C-S.
Mimics.
Yeah.
Okay, sir.
You can find that. So there are nearly 1,115 layers are generated.
Oh.
So this is the very bottom layer. And when I keep on moving the layer one over other, so this is the layer 2.5. So it takes all the information like including tissues, blood. So all those things are available. So it is possible to only taken out the information about the bones just by means of Hansfield number. Every biomedical has its own Hansfield number. By just picking that particular Hansfield number, you can develop the model. See here, this is a 1,194 layer, and the left side view as well as the back view is also available. Yeah, on the left side, you can see the two views, right? So this is called a chronological view. I think I don't want to speak much about the terminologies now. Every layer you can find information.
Okay, suppose. And
so it's a collection of all the layers.
All the layers.
Yeah.
Thank you, sir. Thank you, sir. One more question. Ganesh Ram is asking. It's a common issue. What is recycling of composite material? What are the techniques available recycling of composite material, and what stage it will come? That's a question by Ganesh Ram.
One such thing is when you use composite as a material in the biomedical environment, we will be highly looking for biodegradability. So it degradable in the body itself. If the implants are removed after its service is over, of course it is biodegradable. So it is recycling is very quite simple.
Okay, sir. Okay, sir. Thank you, sir. Okay. Okay. Is there any questions you may post? Otherwise, we can wind up our session. Okay, sir. I think no more questions are available. You have given clear information about the role of composites as well as the fundamentals of biomedical engineering. Thank you, sir. Just I asked to Professor T. Prakash.
Yes, sir.
Deliver.
Yes, sir. Yes, sir. Thank you, sir. Thank you, sir. So once again, warm greetings to everybody. It's good time to propose vote of thanks. It's a great honor to me to propose vote of thanks on this occasion. So first, I would like to thank today's resource person, Dr. T. Ramesh, sir, Associate Professor, Department of Mechanical Engineering, National Institute of Technology, Trichy, for his excellent and informative webinar. Sir, the session is really meaningful and very informative one. Thank you very much for your continuous support towards TCE, sir. Thank you, sir.
Thank you.
Thank you. I record my sense of deep gratitude to our TCE management and the respected principal, Dr. S. Mercedes only, ma'am, to allow us to conduct this kind of webinars. Thank you, ma'am. I'm extremely grateful to our beloved head of department, Dr. K. Chokolingam, sir, for his continuous support and guidance. Thank you, sir. I express my sincere thanks to all deans, HODs, and faculty members of TCE. Thank you all. So I express my sincere thanks to Dr. V. Balasubramani, sir, Assistant Professor, Department of Mechanical Engineering. So organizer of this webinar. Thank you, sir. Without you, this program wouldn't happen. Thank you, sir. Finally, I would like to thank all mechanical engineering faculty members and students for their active participation and involvement. So without your involvement, this program won't get success. Thank you all, and we will meet on another webinar. Thank you, sir. Thank you all.
Thank you.
Thank you, sir. Thank you, Prakash. Thank you. Thank you, Ramesh, sir. Thank you, sir. We'll see you, sir.
Thank you, sir. Thank you, sir.
Prakash, recording close பண்ணிருங்க.